very warm welcome to our webinar, Patient Safety Matters, Uncovering Hidden Diagnosis Gaps and Integrative Ayurvedic Solutions. I'm Dr. Prasida, the Healthcare Advisor at VIAMS, and I will be your host today. Thank you all for joining us on this occasion of World Patient Safety Day. We are excited to have a diverse audience including patients, caregivers, and healthcare professionals here with us. Today, we unite with a common purpose to shed light on patient safety, especially the often hidden gaps in diagnosis, and to explore how integrating Ayurveda with modern medicine can offer safer solutions. On behalf of the VIAMS team, I extend a warm welcome to each of you. And this session is being held in observance of World Patient Safety Day, a day when people worldwide focus on making healthcare safer. Patient safety is not just a concern for doctors and hospitals, it matters to every one of us as patients or caregivers. In today's webinar, we aim to raise awareness about critical patient safety issues like misdiagnosis and medication side effects, and discuss how a holistic, integrative approach can help address these challenges. We encourage you to listen, learn, and participate. Your questions and insights are most welcome. Let me introduce our panel for this webinar. I am the host and moderator, making sure things run smoothly. And our key speaker today is Dr. Vijay KV, Managing Director and Chief Physician of VIAMS. Dr. Vijay is an experienced Ayurvedic physician who has dedicated his career to integrative healthcare and patient safety. He will be sharing his insights and expertise with us shortly. Also, with us is Dr. Neetu Esjit, addressing role of family and caregivers, and Dr. Aditya, our resident medical officer at VIAMS, who will handle the Q&A session at the end. So please feel free to note down your questions. We will address them after the main presentation. It's my pleasure to introduce Dr. Vijay KV. Dr. Vijay has over 2 decades of experience in Ayurvedic medicine and integrative patient care. As the Chief Physician and Managing Director of VIAMS, he has led numerous initiatives to blend Ayurveda with modern medical practice for improved patient outcomes. His expertise lies especially in managing chronic diseases through Ayurvedic therapies, dietary and lifestyle modifications, all while prioritizing patient safety. Under his guidance, VIAMS has helped many patients navigate complex health issues more safely and holistically. And we are truly honored to have him lead today's session. Without further ado, I invite Dr. Vijay to take over the session.
Thank you, Dr. Prasida, for the kind introduction and welcome. So, namaste everyone. I am Dr. Vijay KV. It's wonderful to see so many of you here, ranging from healthcare professionals to patients and caregivers, all interested in patient safety. Since we are marking World Patient Safety Day, let's start with a brief insight into what this day is about. The World Health Organization established this observance in 2019, and it is held every year on 17th September. It was founded on the fundamental principle of medicine. First, do not harm. On this day, people around the globe join hands to raise awareness about patient safety and to promote actions that ensure no one is harmed in the process of healthcare. Each year, World Patient Safety Day highlights a specific aspect of patient safety that needs urgent attention. For instance, the theme for the World Patient Safety Day 2024 was Improving Diagnosis for Parkinson for Patient Safety, with the slogan, Get it right, make it safe. So this theme is very relevant on our discussion today. It underlines that getting the correct and timely diagnosis is a critical part of safe care. In fact, diagnostic errors are considered to account for roughly 16% of the preventable harm in healthcare. Think about that. A significant chunk of harm that happens to patients could be avoided if we improve the accuracy and timeliness of diagnosis. The WHO has noted that most adults will experience at least one diagnostic error in their lifetime. So these are striking findings that show why we must focus on diagnosis when we talk about patient safety. World Patient Safety Day's broader message is that patient safety is a global health priority. It calls for stakeholders, doctors, nurses, health leaders, patients, and families to work together so that healthcare becomes safer. It's about creating a culture where safety is at the forefront, where we encourage reporting and learning from errors rather than blaming, and where patients are put at the center of care. Today, in line with that mission, we will be focusing on two major patient safety challenges: diagnostic gaps or misdiagnosis, and long-term impacts of medical treatments. We also look at how Ayurveda and an integrative approach can help in closing these gaps and mitigating harms. So let's dive into our first topic, misdiagnosis. Yes, misdiagnosis, a global concern. Imagine going to doctor after doctor because you feel unwell, yet no one can pinpoint what's wrong, or worse, they tell you the wrong thing is wrong. This scenario is more common than we would like to think. So misdiagnosis, whether it's completely wrong diagnosis or a significantly delayed one, is a global healthcare concern. So studies show that diagnostic errors are a worldwide crisis. Research indicates that 5 to 10% of output diagnosis may be incorrect, meaning tens of millions of patients across the globe are affected each year. Of these, several million suffer serious harm, and hundreds of thousands of deaths annually are linked directly to misdiagnosis. The burden is particularly high in low and middle income countries, where limited resources or delayed access to specialists further increases risks. Misdiagnosis can happen for many reasons. Sometimes symptoms are unusual or mimic other diseases. Sometimes there are system issues like rushed appointments or lack of proper tests, or cognitive biases can lead a clinician down the wrong path. Regardless of the cause, the outcome is that the patient doesn't get the correct treatment in time. The impact on patients can be profound. A wrong or late diagnosis often means wrong treatment or no treatments for the real issue. So the illness can quietly worsen. Everyone's looking the other way, treating something else. Complications that could have been prevented might develop. For the patient, this is not just a physical risk, it's emotional distressing. You might start to feel like something is wrong with me, but no one is really listening or believing me. In fact, I recall the patient describing his experience in misdiagnosis of the stress of knowing something is very wrong, but feeling like no one who can help believes you. It's a devastating place to be. Misdiagnosis also shakes the trust patients have in the healthcare system. If you have been misdiagnosed once or repeatedly, you may lose confidence in doctors or hesitate to seek care next time, and that can lead to further harm because you don't get help when you need it. So misdiagnosis is not a rare minor issue, it is a common and consequential And our goal in healthcare must be to reduce these diagnostic errors through better training, better systems, and by listening to patients more carefully. In the next few slides, we will walk through a few case examples to illustrate how misdiagnosis can occur and what struggles patients face as a result. So, the case number 1 is cervical myelopathy. Some of you might be aware of this name or this disease. So, let me share a real case that came to me just a year ago. A gentleman of around 50 years, I'm not disclosing the name, presented with mild hand tremors, spasms in the neck and shoulders, tingling sensations, reduced neck movements, and noticeable reduction in arm swing. So, without pursuing further investigations, his initial doctor diagnosed him with Parkinson's disease. So, this solely based on these symptoms and immediately started him on artificial dopamine medicines. Within days, his condition worsened and he sought my opinion as a specialist in Parkinson's disease. During my consultation, I insisted on a thorough evaluation, including an MRI of the brain with screening of the whole spine, along with essential blood tests. So the blood tests were normal except for some mild vitamin D insufficiency. Importantly, the MRI of the brain showed normal study, but the imaging revealed the actual diagnosis, cervical myelopathy, that is a compression of the spinal cord in the neck. So as cervical myelopathy is confirmed, I didn't recommend him Trodad scan for dopamine tracker, which is a crucial investigation method in Parkinson's disease. So we immediately tailored an integrated treatment plan consisting of Ayurveda therapies, Panchakarma, physiotherapy. So while carefully tapering down the unnecessary anti-Parkinsonian medications. So within 3 months of consistent integrative care, the patient had completely stopped the dopamine medicines, achieved near complete recovery, and returned to work. So this case underscores a critical lesson. Never rely on assumptions or symptomatic impression alone for chronic diseases, since long-term or even lifelong medication is often required. A correct, thorough diagnosis is essential. A second opinion and appropriate investigations like MRI or specialized test can make the difference between a lifetime of unnecessary medication and chance for a fully recovery. Coming to the next case, it's a clear case of Myasthenia Gravis. So this Myasthenia Gravis is basically a autoimmune musculoskeletal disorder, and this is a real case we managed recently. Just a 30-year-old woman came to us after months of struggling with unusual symptoms, intermittent drooping of her eyelids and double vision, and episodes of muscle fatigue. So some days she felt almost normal, while on others her neck was too weak to support her head, or she could barely climb stairs. Unfortunately, the early consultations with the doctors led to the assumption that these complaints was stress related or psychological, or even a sign of a stroke. So she was prescribed anti-anxiety medicines and even labeled as overworked. As the time went, her condition worsened. One day she developed a severe crisis with the extreme weakness and breathing difficulty. At the hospital, further tests finally confirmed the true cause is Myasthenia Gravis, an autoimmune condition affecting nerve-muscle communication. She and her family then consulted us at VIAMS, seeking a holistic and safer approach on long-term care. As usual, we designed an integrative treatment plan combining Ayurveda therapy, physiotherapy, Ayurveda Panchakarma treatments, and psychological counseling. So, Ayurveda had strengthened her neuromuscular function, physiotherapy improved stamina and muscle control, while physiological support helped her to overcome the emotional trauma of being dismissed for months. Within a few months of consistent integrative care, she regained confidence, resumed her normal activities, and truly got her life back. So, this case highlights how vital it is to look beyond labels like stress or anxiety when the symptoms persist, and how integrative care can restore both health and hope in patients facing chronic neurological conditions. Coming to the case number 3, that is inflammatory myositis. So, our third real case is about a 45-year-old patient who came to us after a long struggle with muscle weakness. Over nearly a year, they noticed progressive difficulty in lifting objects, climbing stairs, or even raising their arms to comb their hair. Initially, these symptoms were dismissed as normal aging or being out of shape, and the patient was advised to exercise more and take pain relievers and vitamins. Unfortunately, the true disease was quietly progressing. When the weakness became so severe that even standing from a chair was difficult, further evaluation revealed the actual cause is inflammatory myositis, confirmed through elevated CPK levels and a muscle biopsy. The patient was prescribed long-term immunosuppressive medicine and corticosteroids, which did help temporarily, but the prospect of lifelong medication and side effect was overwhelming. That is when the patient approached us at VIAMS. We developed a tailor-made integrated treatment protocol blending Ayurveda therapies, Panchakarma, physiotherapy, and diet support, and careful tapering of steroids under strict medical supervision. Over the course of the treatment, the patient was gradually able to reduce and finally stop the steroids altogether. The symptoms steadily resolved, strength returned, and the patient was able to walk back into normal life with comfort and confidence. This case highlights the power of an integrated Ayurveda treatment protocol, not just in managing symptoms, but in reducing dependence on lifelong medications and giving patients the chance of reclaim their quality of life. Excuse me, I'm taking a short break. During this break, I would like to invite Mr. Radish Manoharan, our Director of Operations, to introduce our flagship product, Mydopa. Over to you, Radish.
Namaste, everyone. Hope you are doing fine, everyone. So, I just want to tell you some words about our flagship product, which is Mydopa. I'm very much excited to introduce Mydopa over here. I would say this is a magical herbal supplement designed to support individuals with Parkinson's disease and neurodegenerative disorders. We have found this unique blend of 100% natural Ayurvedic ingredients, including kapi kachu. You may have heard about velvet beans, and ashwagandha, Indian ginseng, and tribala, which is a magical another combination from Ayurveda. And Mydopa offers several benefits like including controlling tremors, supporting cognitive functions, supporting cognitive health, providing natural dopamine support, and promoting gut health. Mydopa works very naturally, balancing dopamine levels, improving motor coordination, and reducing tremors. It is not just an Ayurvedic or herbal product which we have going through different rigorous testing as per Ayush certified lab, ensuring safety and efficacy. We are following almost 52 quality tests, and this is packed in 30 sachets, so that every sachet can help you as a daily dose of wellness, which is going to help in your daily life, which improves as a supplement and herbal supplement. That's the beauty of Mydopa. I hope this is going to help you. Our product is going to help you in your very daily life, helping in your cognitive functions, motor functions, etc. Vijit, hope you're back.
Yeah. Thank you. Thank you for introducing my purpose. So let's move on. So now we are moving to the important part of this webinar. How we can avoid the diagnostic errors. So the real cases show how misdiagnosis can happen in any specialty. The question is, how do we prevent it? First point, listen to patients. Patients and caregivers often sense when something is wrong. Taking time to hear the full story without dismissing unusual symptoms is essential. Point number 2, keep a healthy doubt. If treatment isn't working or the picture doesn't fit, the doctors must pause, reconsider, and seek further test or a second opinion. So the patients too should feel empowered to ask for another perspective. Point number 3, use diagnostics wisely. Lab tests, scannings, or biopsies should be used when clinically justified. An early MRI or simple blood test can save months of suffering. Fourth point, be aware of biases. Avoid anchoring to the first impression or attributing new symptoms to stress or existing conditions without proper investigations. For patients, keeping records and timeless and politely raising concerns can reveal important patterns. Ultimately, diagnosis is a team effort. Doctors, patients, and families working together. By listening, questioning, and using tools effectively, we can reduce errors and make care safer. So let's discuss about the long-term side effects of long-term medication. Conventional medicine has given us powerful tools to combat disease, and there is no doubt that these medicines saves millions of lives. But when it comes to chronic illness, conditions that require treatment for years or even a lifetime, we must be aware of the risk that prolonged medication can bring. Different categories of medicines used for pain, inflammation, autoimmunity, or neurological disorders often come with predictable side effects. Pain relievers can damage the stomach or kidneys. Long-term anti-inflammatory or immune-suppressing medicines can weaken the bones, raise blood sugar, and increase infection risk. While drugs used in degenerative neurological diseases like Parkinson's may control symptoms but often lead to complications such as dyskinesia, fluctuations, or worsening dependency over time. Polypharmacy, the use of multiple medications in elderly patients, further raises the risk of harmful drug interactions and hospital admissions. So while modern medicine are essential, their safety in long-term use is limited. That is why it is crucial to regularly re-evaluate the necessity, dose, and duration of these treatments. At the same time, alternative systems like Ayurveda offer gentle, safer options for chronic disease management, focusing on symptom relief, functional improvement, and overall well-being, often with fewer side effects. By integrating Ayurveda with modern medicine, we can reduce dependence on high-risk drugs, improve safety, and enhance quality of life for patients with long-term medications. Now, let's talk about the integrative medicine, a safer path. So, integrative medicine is about combining the best of modern science with the wisdom of traditional systems like Ayurveda to achieve safer and more complete patient care. It is not a question of either or, but rather how both can work together to reduce risk and improve outcomes. In chronic and neurodegenerative disease like Parkinson's disease, dementia, Alzheimer's, progressive supranuclear palsy, different types of ataxias, this integration becomes very crucial. Conventional medicines are often effective in short term, but their long term use can bring complications like dyskinesia, as I mentioned earlier. So, this is where integrative care makes a difference by blending Ayurveda therapies, Panchakarma therapies, integrative treatments like physiotherapy, yoga, dietetics, psychological support, etc. So, we create a treatment plan that controls symptoms, supports the nervous system, and minimizes the burden of side effects. So, at our institute, VIAMS, we have been practicing and refining this unique integrative protocol for over 12 years, and in that time, we have helped thousands of patients. Many have been able to taper down strong medications, regain mobility, improve speech and balance, and return to daily life with greater independence. These are not isolated outcomes. They represent consistent, real-world evidence that integration is safer and more effective for long-term care. So the heart of this approach lies in safety and sustainability. Modern medicine provides precision when urgent intervention is needed, while Ayurveda and allied therapies provide depth, nourishment, and long-term stability. Together, they address not just symptoms, but the whole person, the body, mind, and spirit. So, making recovery more complete and reducing the risk of chronic drug dependency. This is why integrative medicine is not just an alternative, it is a safer path forward, especially for lifelong conditions like Parkinson's disease, where patient safety, quality of life, and dignity matter most. So, why Ayurveda in chronic care? Ayurveda is one of the world's oldest healing sciences, means the science of life. Unlike approaches that treat a disease in isolation, Ayurveda focuses on restoring balance of body and mind. This makes it especially valuable for chronic disease management. So the personalized approach in Ayurveda, every individual has a unique constitution. So Ayurveda considers physical health, mental state, lifestyle, diet, and even environment before planning treatment. Two patients with the same disease may receive different therapies based on their root causes, a concept now occurred in modern personalized medicine. The second is the root cause and prevention. Ayurveda looks beyond symptoms, asking why they occur. Instead of quick fixes, it identifies and treats the underlying imbalance, preventing relapses. So the preventive care through daily, that is, we mentioned it as dinacharya, and the seasonal, that is the ridhucharya, routines. So the daily and seasonal routines, diet and lifestyle help patients avoiding flare-ups and complications. So Ayurveda, the natural and tolerable remedy. Herbal and plant-based remedies, when prescribed properly, are generally well tolerated for long-term use, with far fewer side effects than any other synthetic drugs. So this makes them safe companion for chronic disease care, though they must be used judiciously. Lifestyle and self-empowerment. Ayurveda integrates diet, physical exercise, yoga, meditation, and stress management into daily living. So this holistic guidance empowers patients to actively participate in their healing, improving both outcomes and confidence. So, in essence, Ayurveda aligns with the principle of patient safety, treat without harm, strengthen resilience, and empower the patient. This is why It is an invaluable partner in modern chronic care. Moving to the next topic, the Ayurvedic therapies at a glance. Let us take a quick glance of some of the core Ayurvedic therapies. First, herbal remedies and detox. So, Ayurveda relies heavily on healing power of the plants. Formulations prepared from roots, leaves, seeds, and minerals are tailored to each patient's unique constitution. So, these herbal medicines are not just for symptom relief, but for correcting imbalances in the body. Along with this, the Panchakarma, the classical detoxification therapy, helps in systematically cleansing the body, flushing out accumulated toxins, and rejuvenating tissues. This combination allows the body to recover, function more efficiently, and prepare itself for long-term healing. Second, lifestyle and mind-body therapies. So the Ayurveda always emphasizes prevention and holistic wellness. A personalized diet plan is creating according to one's body type and health condition, ensuring proper nourishment and digestion, that is the metabolism. Alongside diet, yoga postures help maintain flexibility, strength, and balance, while meditation practices calm and mind reduce stress and restore emotional stability. Together, these approaches strengthen immunity, enhance energy levels, and promote mental clarity, making Ayurveda not just a system of medicine but a complete way of life. So, when we talk about Ayurvedic therapies, it is not about treating disease alone. It's about nurturing the body, mind, and spirit, and creating harmony at every level. So, Ayurveda's role in safer care. So, from a patient safety perspective, Ayurveda plays a vital role in reducing risk and improving long-term outcomes. The first one is reduced drug burden. So, by supporting disease control with natural remedies and therapies, Ayurveda often allows for lowering the dose of high-risk pharmaceuticals. For example, arthritis patient may need painkillers only occasionally if Ayurvedic medicines and yoga manage symptoms on most days. Safe chronic care. Ayurveda offers effective options where modern medicines lack long-term solutions such as IBS or functional disorders. Patients often experience relief without escalating to stronger drugs that can carry heavier side effects. Supportive therapies. Local treatments like Abhyanga, that is the therapeutic massage, and specialized oil applications can ease pain, neuropathy, or stiffness and rigidity, reducing dependency on sedative pain medications. A collaborative integration. True safety lies in coordination. When Ayurvedic and allopathic doctors work together, treatments complement each other, avoiding harmful overlaps and ensuring holistic progress. At our institute, VIAMS, our integrative model has consistently shown that patients achieve equal or better outcomes with fewer side effects, regaining quality of life while staying safe. Now, empowering patient care. Patient safety begins with patient themselves. An informed and engaged patient is always a safer patient. Stay informed. Understand your condition and treatments. This knowledge helps you notice if something is wrong. Ask your questions about the medicine, test, or side effects so the clarity prevents errors. Communicate openly with your treating doctor. Share all your symptoms, even minor ones, Don't neglect a minor cause. Keep health records and timeless to relevant patterns. Adhere wisely. Follow agreed plans. But raise concerns if treatments are difficult or side effects troubling. Trust your instincts. If something feels wrong, revisit your doctor or seek a second opinion. Active participation creates a partnership with doctors, ensuring better and safer care. So, thank you all. As we have seen, empowering patients through awareness, communication, and active participation is the foundation of safer care. But patient safety is never a journey taken alone. It is always supported by those around us. At this point of this webinar, I would like to warmly invite Dr. Needu S.G., the Medical Superintendent and the Director and the Parkinson's Disease Specialist for Women at VIAMS, our institute, to share her insights on the role of family and caregivers in ensuring patient safety and recovery. Dr. Needu has been deeply involved in patient-centered care and brings a wealth of experience in guiding families to become effective partners in healing process. Dr. Needu, over to you.
Thank you, Dr. Vijit. Let's start the part, role of family and caregivers. Alongside empowered patients, we must never forget the crucial role of families and caregivers. In fact, they are often the unsung heroes of healthcare, and their contribution directly impacts patient safety and recovery. The first point, caregivers as advocates. Many patients, especially those with chronic or neurological disease, may not always be able to explain their symptoms fully. A spouse, child, or sibling can step in to fill those gaps, providing timelines, describing changes in behavior, or highlighting difficulties the patient might ignore. For example, in Parkinson's disease, a patient may downplay tremors or mobility problems, but their spouse notices subtle changes in sleep, mood, or balance. This extra information often makes the difference in accurate diagnosis and safer treatment. The next point, ensuring medical safety. Polypharmacy is common in chronic illness. Patients may be on 5, 10 or more medicines daily. Caregivers help organize schedules, avoid missed doses, and prevent dangerous mistakes like double dosing. A simple tool like a pill box or phone reminder made by a caregiver can prevent life-threatening errors. This is patient safety at the most practical day-to-day level. The third point, observation and early warning. Caregivers see the patient every day and often notice small but significant changes. That means loss of appetite, fatigue, new side effects, or worsening symptoms. A doctor may see the patient maximum for 15 to 30 minutes in his OP clinic, but the caregiver is there 24/7. When caregivers promptly communicate these changes, interventions can be made before a crisis occurs. The fourth point, emotional and psychological support. Living with a chronic disease can be isolating. The patient may feel frustrated, depressed, or lose confidence. A supportive family member provides motivation, reassurance, and encouragement to follow through with treatment plans. This emotional support or emotional strength has measurable effects on recovery. Patients who feel supported tend to adhere better to therapies and show improved outcomes. Fifth point, encouraging second opinions and further evaluation. Sometimes recovery is slow or the diagnosis doesn't feel right. Here, caregivers play a powerful role in encouraging the patient to seek a second opinion or undergo additional tests. At VIAMS, we have seen many real cases where a family member's insistence on digging deeper led to the correct diagnosis and ultimately saved the patient from unnecessary lifelong medications. Sixth and last point, a shared responsibility. Finally, caregivers must remember to take care for themselves too. Burnout is real and a tired caregiver cannot give their best. Building support networks, sharing responsibilities, and seeking professional help when needed ensures that both the patient and caregiver remain safe and healthy. To sum up, caregivers are not just bystanders. I repeat, caregivers are not just bystanders. They are active partners in patient safety. They advocate, they monitor, they support, and sometimes they even guide the direction of care. At VIAMS, we have repeatedly seen that when families are involved, outcomes are better, safer, and more satisfying. Truly, healthcare is not complete without the family standing beside the patient. As we reflect on the role of family and caregivers, let us remember this. Healing is never a solo act. It's a symphony played by patients, caregivers, and doctors together. When families stand strong beside the patient, safety becomes natural and recovery becomes possible. On that note, I thank you all for listening. I now hand the session back to Dr. Vijit KV to take us forward.
Thank you, Dr. Needu, for the wonderful insights on the role of family and caregivers. So now we are moving to the next session, that is the question and answer session. So you can type your questions in the chat box, and before we begin the question and answer session, I want to thank you all for your attention so far. We have covered a lot of ground, and I'm sure you might have questions or want to share your own experiences. So this is a great time to do that. I'm delighted to welcome Dr. Aditya, our resident medical officer at VIAMS, who will be moderating the question and answers session. Dr. Aditya, over to you.
Thank you, Dr. Vijit, for that insightful presentation. We will now start the question and answer session. I am Dr. Aditya and I will be moderating this part. For our audience, if you have a question, please type it in the chat box or use the raise hand feature and we will call on you. We want this to be an interactive discussion. We already have a few questions that have come in during the talk. I will read them out one by one and direct them to Dr. Vijit for answers. Also, if a question is directed to something that Dr. Neetu, Dr. Prasida or I can answer, we will take that as well. Let's keep the questions focused on today's topic, patient safety, diagnostic issues, Ayurveda and integrative approaches. You can ask your queries in your mother tongue also. Kindly share your questions.
Yeah, I think the chat box is empty, so somebody can ask about this, what we have talked so far, and want to know anything and or to share your experiences. Please unmute your mic and talk, please. Okay. Yeah, Millie is here from Lithuania. Devadatta sir is here from Moscow. Okay, good. So anybody have any questions regarding this, or anybody want to share any of your experiences? Please raise your hand and unmute and talk. Yeah, Millie has messaged me. Yeah, okay. Knowledge about the disease. Okay, fine. Millie, if you want to talk something, you can just unmute your mic and talk.
No, I don't want to talk. Sorry.
Are you okay, Millie? All good?
I'm not very sure about my English. Sorry.
It's all right. Okay, you may be familiar with Lithuanian. Yeah, it's okay. Fine. Okay, thank you for the message, Millie. Millie had messaged me that all these are very important for patients with Parkinson's disease. Okay, thank you.
Hello?
Yes.
Hello?
You're audible, DR. You can speak now.
Right. Rajesh here from Malay.
Okay.
Hello?
Yes.
Can you hear me, doctor?
Yes, I can hear you, but not clear.
Okay. There's one in WhatsApp is showing one video showing that a new medicine has been disclosed for effective. Is it true or not?
You're asking that whether this is completely curable.
No, it's not completely. It's almost effective. It's more effective than the normal one. It's what's it called?
The question is not completely clear. If Aditya or Prasida can understand the question, please share with me or just answer the question.
So can you please type your question in the chat box?
Okay.
Yeah, thank you, sir. Thank you. So moving to next. Okay, so if anybody have any questions, please type in the chat box. We will discuss in the end of the meeting. So Aditya, you can move forward. Skip that and.
So we are now approaching the end of our session. If anyone have any questions, please type
I have
it.
one question.
Yeah, please.
Yes, ma'am.
എന്റെ പേര് മിനി എന്നാണ്. എന്റെ മദറിന് വേണ്ടിയിട്ടാണ് ഞാൻ ചോദിക്കുന്നത്.
Okay.
സാറിന് ഓഡിബിൾ ആണോ?
Yes, audible ആണ് Dr. Mini.
സർ, എന്റെ അമ്മ ഇപ്പോൾ 78 years ആയിട്ടുണ്ട്. ഒരു 13 years ആയിട്ട് പാർക്കിൻസൺ പേഷ്യന്റ് ആണ്.
Okay.
അപ്പം അമ്മയ്ക്ക് ഈ തെറാപ്പി ഒക്കെ പോസിബിൾ ആണോ ഇനി? എന്നുവെച്ചാൽ അമ്മ അതിനോടൊന്നും വെല്ലിങ് അല്ല. ആദ്യം മുതൽക്ക് തന്നെ ഡോക്ടർ ഫിസിയോതെറാപ്പിയെ കുറിച്ച് പറയുന്നുണ്ട്. പക്ഷെ അമ്മയ്ക്ക് അത് താല്പര്യമില്ല, ഇന്ന് വരെ ചെയ്തിട്ടില്ല. അപ്പൊ വീട്ടില് ഞങ്ങളും പറയാറുണ്ട് അതൊന്ന് ചെയ്യുന്നത് നല്ലതാണെന്ന്. അപ്പം അമ്മ അതിനൊരു വില്ലിങ് അല്ല. അമ്മ റിട്ടയർഡ് ടീച്ചറൊക്കെയാണ്, കാര്യങ്ങളൊക്കെ അറിയാം, വളരെ ആക്റ്റീവ് ഒക്കെയാണ്, റീഡിങ് എല്ലാം ചെയ്യുന്നുണ്ട്. പക്ഷെ അമ്മയ്ക്ക് ഇങ്ങനെയുള്ള കാര്യങ്ങളൊന്നും ചെയ്യാൻ വലിയ ഒരു എന്താ പറയാ മൈൻഡ് ഇല്ല. അപ്പൊ അതിനെന്താണ് നമ്മൾ ചെയ്യേണ്ടതെന്നാണ് ചോദിക്കുന്നത്.
Okay. Thank you for the question, Dr. Mini. So, Dr. Mini has asked the question that her mother is suffering from Parkinson's disease for the last 13 years. Now she is on 78 years of age, so started at the age of 65, and she is not willing to do any Ayurvedic therapies or physiotherapy as the doctors advise. So she's asking that whether even if any therapies is possible in this stage. Yes, Dr. Mini, it is surely possible in this stage, but we have to take either an online consultation or a physical consultation to know about the physical condition of the patient. Then only we will move to, if possible, we will move to do the Panchakarma therapies or other therapies.
Okay, right, sir. And also one question, sir. നമ്മൾ ഈ മറ്റ് മെഡിസിൻസ് കഴിക്കുന്നതിന്റെ കൂട്ടത്തിൽ ഈ മൈഡോപ്പ കഴിക്കുന്നതിൽ എന്തെങ്കിലും ബുദ്ധിമുട്ടുണ്ടാവോ?
എന്തായിരുന്നു ക്ലിയർ ആയില്ല, ഒന്നുകൂടെ പറയോ?
നമ്മളിപ്പം അമ്മ മെഡിസിൻസ് ധാരാളം കഴിക്കുന്നുണ്ട്. അപ്പം അതിന്റെ ഇടയിൽ നമുക്ക് ഈ മൈഡോപ്പ കൂടി അതിന്റെ കൂടെ കഴിക്കാൻ പറ്റുമോ?
തീർച്ചയായിട്ടും കഴിക്കാൻ പറ്റും. ഈ മൈഡോപ്പ എന്ന് പറയുന്ന ഒരു പ്രോഡക്റ്റ് നമ്മൾ ഡിസൈൻ ചെയ്ത് എന്തിനാന്ന് വെച്ച് കഴിഞ്ഞാൽ ലോങ് ടേം സൈഡ് എഫക്ട്സ് ഉണ്ടാവും. പാർക്കിൻസൺസ് പോലെയുള്ള അസുഖങ്ങളിൽ ലോങ് ടേം സൈഡ്, ഞാൻ നേരത്തെ പറഞ്ഞില്ല, ഡിസ്കൈനേസിയ പോലുള്ള സംഭവങ്ങൾ ഉണ്ടാവും. So you can use Mydopa along with the Syndopa, and once you're feeling better, you can cut down the dosage of the dopaminergic medicine like Syndopa or any other medicines, and you can shift to Mydopa slowly. and you can seek the help of our healthcare advisors anytime.
Okay, thank you, sir. One more doubt. ഇതൊരു ഹെറിഡിറ്ററി ആയിട്ട് വരാൻ സാധ്യതയുണ്ടോ?
സാധ്യത ഉണ്ട്, നിർബന്ധമില്ല. There are chances of hereditary in Parkinson's disease, but not confirmed.
Early symptoms ആണെന്ന് പറയാമോ?
Early symptoms ആയിട്ട് നമുക്ക് the Parkinson disease have mainly 4 symptoms, that is tremor, rigidity, echinacea and posture. Tremor means like even in one hand or 2 hands tremor will start slowly. Then rigidity in the neck will be there, neck or shoulder position will be there. Walking difficulty will be there. Tendency to fall will be there. Cognitive impairments like sleep disturbances, fearful dreams, hallucinations, high tension, anxiety, emotions will be there. So these will be the initial things. So if anybody parents, any of the parents have this Parkinson's or neurodegenerative disease, the next generation they have to take a regeneration Ayurvedic treatment once in a year from at least the age of 45. Then we can slow down the what we say, like we can the longevity will be increased.
Okay, right, sir. It will take how many days?
That is a procedure of 15 days, because we are doing it as a regeneration therapy.
Okay, 15 days.
Sorry, 15 days.
Okay. Thank you, sir. Thank you so much for your valuable advices.
Thank you. So, M has been asked, does MyDopa have any regulations on taking time, morning or evening, between or regular drugs? So, very good question. You can take MyDopa before food. Like now, somebody is each and every patient will be on levodopa and carbidopa medicine. So it will be better to take a gap of at least 30 to 60 minutes gap for taking this MyDopa and the levodopa medicine. So if you're taking like 3 times levodopa, I recommend you to take MyDopa by 11 a.m. and 3 p.m. So it will be a gap time. And if you're taking this levodopa in 11, you can take MyDopa at 10 o'clock or 12 o'clock.
Okay.
I think it's clear.
Okay, thank you, sir. Thank you so much.
Thank you.
Hello, doctor.
Yeah, so please move on, and we will once again go through this question and session by the end of the webinar.
There is one more question, sir.
Please.
Importance of investigation in misdiagnosis.
Importance of
investigations like MRI.
Yeah, see, see if this misdiagnosis will happen mainly in chronic diseases. So chronic diseases or chronic conditions means we have to take long-term medications or lifelong medications. Suppose if just take Parkinson's disease. So I had clearly mentioned that cervical myelopathy, Myasthenia Gravis and myositis. So these 3 diseases should misdiagnose as Parkinson's disease. So if it is a Parkinson's disease, we can go through some blood test. We can go through a CT of a brain or an MRI of a brain. If you're doing an MRI of a brain, you can add that screening of whole spine into that. And if there is any structural damage, that means cerebral atrophy, or infraxis, there old hemorrhagic something will be there, then we can say that a degeneration is there in the brain. If there is if your brain MRI is normal and still the doctor is saying that you are having Parkinson's disease, then you have to go for a dopaminergic test, that is a product test. So that will definitely reveals whether there is a lesser production quantity of the dopamine in your brain. If there is a lesser dopamine production in your brain, then you have to take that Parkinson's medicines. Other than you are not you don't take that Parkinson's medicines. Muniappa has asked, my name is Muniappa from Bangalore, recently consulted with you, Parkinson's disease in right side since 1 year. My question is, allopathy medicine 5 types plus you have gained 6 medicine. I am afraid taking so many medications. Mr. Muniappa, I should humbly say you that don't consider Ayurvedic medicines and like a allopathic medication. Consider this as a food supplement, like a herbal medicine. These are all plant-based, and you don't want to take any dietary regulations or anything. So the number doesn't matter. The quality of the medicine should matter. Please give me a review after 3 weeks of using that medications. Thank you. Any other question, Aditya?
No, doctor.
Okay, just move on. If there is any questions, we will discuss at the end of the webinar. Okay.
Okay. Thank you for those great questions, and thank you, Dr. Vijit, for the comprehensive answers. Sir?
Yeah.
There is one more question.
Please.
Is this Parkinson reversible?
Not completely reversible. Parkinson's disease is a chronic disease. So any of the chronic disease is completely reversible. So Parkinson's disease is a progressive neurodegenerative disorder affecting the nerves and the muscles. So it is not completely reversible, but definitely if you manage this in a proper way, like a diabetes, how you are managing, like a hypertension, how you are managing, like a thyroid problem, how you are managing, you can manage this Parkinson's disease and you can improve your longevity.
Thank you, sir.
Sandy has messaged us, myopathy taking with lukewarm water, but granules are not mixed. Sandy, you just wait for 2 to 3 minutes of time. It is advisable to take in a homogeneous mixture. As it is a herbal extract, it will dissolve completely. Or do one thing, that you just put that myopathy in the glass, you just add like a 5 ml of this homogeneous mixture of hot water, then mix it thoroughly with a stirring plant or a spoon. It will completely dissolve and no sediments will be there, as it is a herbal extract. It is not powder, it is herbal extract. How long can a person live with PD? That's a wonderful question. 5 years, 10 years, 20 years, 40 years. It depends how you manage your Parkinson's disease. So I mentioned that Parkinson's disease is a neurodegenerative disorder affecting the nerves and muscles. So not only the medicine decides the health, the lifespan of a Parkinson's disease patient, but also the food what he is taking, the environment where he is living, the climate what he is living, the physical exercises what he is doing daily, these all matter. So if a patient is following a sattvic like means he can do his work, he can do his family activities, he can engage with his friends, he can travel, but take medicines or supportive medicines which ensures the progression will not be there. Make regular exercises. The final stage of a Parkinson's disease patient will be with a pneumonia or a lung problem. So do the breathing exercise regularly, and the lung capacity will be 100%. Then you can live like anything, 20 or 30 years we can guarantee. No worries about that.
There is a question from
patient going to gym advisable. Yes, it is advisable, but it is not advisable to take heavy lift. Only like a cardiac exercise or a stretching and strengthening exercise the patient can do in the gym.
There is a question from Rajini CP. Maximum number of myopathy can we use in one day?
We had provided 4 or 5 sachets as a maximum. No side effects has been reported. Capsule and sachet same strength. No, capsule is just 350 milligram to 400 milligram, and sachet is 1500 milligram, which ensures minimum 200 milligram of natural levodopa in each sachet.
There is a question from Dr. Mini. What type of foods they can eat?
any food which will be digestible within 60 to 90 minutes of time, whether it is vegetarian or non-vegetarian, that doesn't matter. The food what the Parkinson patient is taking should be digested within 60 to 90 minutes, and then it should be absorbed and converted into energy. That is known as metabolism. And if that metabolism is there in a patient, definitely he don't have any constipation or gastritis problem. Sandy, I want to discuss more. Please let me know schedule. Okay, sure, Sandy. Anyway, the people who have attended in this webinar will be granted with a participation certificate, and if anybody wants a consultation, the first consultation will be free for those who attended this webinar. Okay, thank you very much.
Any
Sandy.
more questions?
Yeah, so more to the closing note, and if there is any questions pending, we will definitely discuss before ending this webinar. So move ahead, Aditya.
Thank you for those great questions, and thank you, Dr. Vijit, for the comprehensive answers. We are now approaching the end of our session. I will hand it back to Dr. Vijit for some closing remarks.
Okay, thank you, Aditya, and thanks to all of you and your questions and attention. As we close, remember this: patient safety is everyone's responsibility. Patients and caregivers must stay informed, ask questions, and communicate properly, openly. Trust your instincts if something feels wrong. As healthcare providers, we must listen and create an environment where patients feel safe. Integrative care, combining Ayurveda with modern medicine, is not about being alternative, but comprehensive. With proper guidance, it reduces risks, improves quality of life, and treats the whole person. My call of action for each of you is simple. Take small steps, double check a prescription, encourage a second opinion, keep a health journal, or share what you learned today. Small actions multiplied lead to big change. So, on behalf of VIAMS, thank you for joining us. Let us all stay vigilant, proactive, and committed to safer healthcare. Stay safe, stay healthy, and keep this conversation alive. Thank you very much. So, anybody have any questions? Please ask. Sandy has asked how to continue this discussion. I think Sandy has already purchased Myropa, and your contact will be here, Sandy. Dr. Nidhi, Sandy's contact with us?
Yes, sir.
Okay, Sandy. So your contact will be here. So as early as possible, we will schedule a consultation, and I will let you know. Okay. DR has asked that I don't have visible tremors, but stiffness make me stand still. Sir, if so, it will not be a typical Parkinson's disease. We can say it as a Parkinsonism or movement disorders, because of the stiffness and rigidity, your movement has been restricted. So we can say it as a movement disorder, sir. Any more questions, Dr. Aditya?
No, sir.
Okay. So thank you all. Thank you for attending this webinar. Please share your feedbacks in the contact number and the email ID we shared over the screen. And according to the attendance, we will send you the participation certificate of soft copy in your WhatsApp number or email ID provided. If any of you didn't get the this participation certificate, please contact us. Definitely we will arrange for the same. Thank you very much, and good night. Namaste. Sarve Sandhu Niramaya.